So first of all, welcome everybody. I think there were some new people coming into, and I am Shireen. I'm a plastic and aesthetic surgeon, and I'm super happy and excited that I am able to speak and share with you my thoughts about plastic surgery and the inner beauty. Most of the people, and you please feel free to ask questions in the chat, or put the hands up button so I know, and then I see when to take a break and let you ask the questions. So most of the people think that plastic surgery and inner beauty don't go together. They go like, this is a paradox. This is not possible. How can one thing go together with the other thing? And honestly, I totally understand that because I used to think that way too. How many of you, who of you thinks that it does not go together either, or has his doubts that it works together? You can raise your hand if you want, or just do the thumb up. Perfect. Thank you. Okay, cool. So um, the thing is, just just to so you'll get to know more about me, I would like to tell you about me, why I became a plastic surgeon. Thank you, Ximenia. I see you. And why I got to this journey, and why I suddenly learned that there's this inner beauty and there's the plastic surgery, and that it beautifully combines and goes together. So I come from a family where my father he's retired, a gynecologist, and my mom was an internal doctor. So I was not very much interested in medicine, but as I saw my parents work, but I really loved arts and aesthetics and everything that had to do with design. When I was 15, my mom had breast cancer, and things have changed. Her life changed, and not only her life, our life changed. And as you know, breast is one of the outer things that you can see, or how you define a woman, or you differentiate a woman with a man. And she at that time had an ablation, so they took away the breast, and she started her journey. And she did not have enough tissue to, it is 30 years now, almost 30 years ago. So she could not get the reconstruction by tissue or by implants, and she had to have these prostheses. And at that time, the prostheses were very heavy, really heavy. And so I've watched once. On the one hand side, I saw the disease, cancer. On the other hand side, I saw my mom, who was this beautiful lady and who changed the way she perceived herself and the way her attitude was towards herself and life due to this disease. And I still was, focusing on artistic stuff. But when I finally had to finish my high school and decided to go to university, I went for medicine. And in my med school, in the last year, I finally fell in love with plastic and aesthetic surgery. I had in my mind to become an oncologist, as my mom had breast cancer. But when I saw plastic and aesthetic surgery, for me, it was like, boom, yes, that's it. It's giving people life quality, giving people, patients back the hope and the life quality. And this is what plastic surgery is about. It doesn't matter if you come from the reconstructive part, so you have a disease or a tumor or whatever, or if you just want to improve your outer look, and if you're a healthy person and you just want to feel better within yourself. So it is all about life quality, and this is what I love so much about this subject. So I think everyone here has some kind of profession, or even if you just sorry to say that, if you are a mother and staying home taking care of children, because it's not a just, you know that at the beginning, when you learn something, you're insecure, you are so focused, you just want to learn, and you're so concentrated that you don't see the whole package, everything. And with the years of being an assistant, a resident, and then becoming a plastic surgeon and attending, in German, they say also Oberarzt, then I had a position. I got more into the routine, and I had more time. And of course, I observed my patients, because I think most of the professions, we get better with each case, with each patient, with each experience that we make. And with the years, I observed that there were some situations that patients were not happy. It doesn't matter if it was, for example, a cancer patient, or if it was an aesthetic patient. So they came, they were not happy. You did some operation, you did some procedure. The procedure went well, but they were not that satisfied as I wished them to be, as I was satisfied, because I saw the result and I said, this is awesome. But the patients, they were not as happy as I wished them to be. And at the same time, I was in attending, I opened with my chief. So in German, you say Oberarzt, second chief. We opened up a new department of plastic and aesthetic surgery. And there you also need to learn leadership skills. And I went to courses and seminars about leadership skills. And the most impressive thing was that it was mainly about communication. And it was not only about communication, but about the communication within ourselves. And continuing with these leadership seminars, learning about communication, I also continued doing an education as a coach and as a hypnotherapist. I have realized that the way we think about ourselves has a very, very huge impact on how we see ourselves, not how we think first and then what we see in the mirror, how we see ourselves. It doesn't mean that what I don't want to say is that by your thoughts, you can change your nose or you can change the size of your breast. I'm not talking about that. Perhaps it's possible one day, but we are not there yet. But what I'm saying is that it is so, 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 so important of what you think and how you treat yourself in your inner talk. Inner talk is we're thinking 60 to 80,000 thoughts a day all the time. And it makes a huge difference if you think you're beautiful and you can do it and you're awesome and you're great and everything is possible, or if you think you're stupid, you're too fat, you're too ugly, your nose is too big, your breast is too small, your hips are too wide, etc., etc. And this is, when I realized that, there was this, at the beginning, I could not get these things together because I said, but this is, this is so important, inner beauty. But then there's this plastic surgery, and where we go all on the outside and we try to improve and make better and change, etc. And at the beginning, I really had a struggle. I did not know how to get these things together, but I did not know how to get inner beauty and outer beauty together because myself, I thought my thoughts that it's either or. You have to decide. Not everything is possible. Perhaps you know these kind of thoughts which come up when you see two beautiful dresses and you go like, no, I just buy one because, two is too much, or you just go and buy all of them, whatever. But there's some situations perhaps that where you learn that or think, or you were brought up in a way that you had to decide between either or. And once I were able to bring these two beautiful subjects, inner beauty and the outer beauty together, this is what I think what plastic and aesthetic surgery and beauty should be about. And if I speak about beauty, I want to go more general in the sense of beauty, cosmetic industry, lingerie, fashion industry, all that stuff. And it is changing already because we've got these different kind of industries who are changing, where you see women from different ages, from different sizes, from different ethnicity, wearing clothes and just being beautiful. So what happens is that our eyes learn something new. We have, I think, a quite range of ages here in this group, but I mean, I belong to that generation where I was brought up with the top models, Linda Evangelista and Claudia Schiffer, and everyone. Some people are nodding. And then there was what is her name? Not Karen Mulder, the other one, blonde, very, very skinny. So that was my sister's generation, where they were even more skinny, the models. So when we are rising as children, we learn from our parents, we learn from our ethical background, I would say. We learn from the society we live in, but we also learn from trendsetters like the fashion industry, what is in and what's not. And I think right now it's like Kim Kardashian is in, so it's changing also. That's also another extreme. But what I want to say is, so what we get used to see and see and see and see again, and every time we see these things and they are anchored with the word beauty, beautiful and successful and have autoesteem, etc., etc. This is how our brains learn what beauty is. So it actually, the word beauty and even ugly and old and young, they might have anchors which are positive, but they might also have anchors which are negative. So which make you feel insecure because you go like, okay, I live, let's take me, I'm blonde now, but I'm usually not blonde. So I live in Germany, and when I grew up, I'm not tanned right now either, but usually I'm quite tanned and have dark hair. And, I grew up in a small town, and I had the impression I have to be blonde and, long and skinny and whatever. And I did not fit in that. Nobody told me I was ugly. Nobody told me I did not fit in, but it was my perception and my interpretation out of what society made up. So this is like the whole context about the inner beauty thing, but it is so important. And I want to go a little bit to the plastic surgery subject. It is so important to become aware of what your personal definition of beauty is, the one that you are inside you, and not the one that you've learned from society. I'll go further. For example, my background is Iranian. So when I was young, lots of Iranian ladies, they colored their hair like me, blonde or a little bit darker. So and even in Iran, if you go to Tehran, you see lots of women who have operated on their noses and they got their nose straight, etc. So it was like this interpretation: they want to be westernized, they want to be Europe, they want to be modern, or etc., etc. And I think this is something that we learn out of whatever reason that might be in the bag. The reason is not important. What is important is that we find out what is the real definition of my beauty, my soul beauty, my heart beauty. Who am I? In what body shape do I really feel comfortable in? Do I have to be skinny to feel comfortable, or is it 2-3 kilos more and I really feel full of power and comfortability and I love myself this way? And I just judge on myself and I don't love myself because I see all this fashion industry and I go like, I have to be that way because, if they see my tummy, they might laugh at me, or I feel ashamed about it. So what I believe, and this is how I work now, is with the patients. I have clients and patients. So with the patients and with the clients is I really support them, first of all, to find out who they want to be. And let's make just a very easy example. So breast augmentation, for example. So women who come and they ask for breast augmentation. I used to be the doctor, I was very functional. You have to see the aesthetic design, the body, etc., etc. But now I ask my questions differently. I ask them, so who do you want to be? How do you want to look like? Because it depends, first of all, of course, it depends always on your body shape. And the body shape, you can have one size. Let's use the models again, because we have lots of models in the magazines. If you have 10 models who have almost the same size and they're all skinny, you will see that all of these models, if you look on bikini models, they have totally different body shapes. Some have longer legs, the other ones have a longer upper body, etc., etc. So it all depends, of course, first of all, on the harmony that your body is giving you, but it also depends on who do you want to be. So I invite my patients, or I also give seminars for girls in poverties to support them in their inner strengths and their inner beauty. So I always tell them, who do you want to be? What kind of woman do you want to be? Why do you do the breast augmentation? Of course, if you ask someone why you do the breast augmentation or whatever, any aesthetic operation, at the first thing they say, I want to feel better. But then you ask yourself 7, 10 times the same question, but why? Because between that, I can wear a bikini, I don't have to wear a bra, or I can wear something with a deep how do you say, cleavage. um, After that, all these answers that are coming, you will see that there's something else in the back why you want to do it. And I'm not saying don't operate, not at all, because I'm still doing it. But what I'm saying is be aware of why. And you can prepare for yourself. You can prepare for yourself to have a better result, a better outcome, to be more happy. Sometimes young women come to me, and they come to me like this. Can you see that? They come to me like this. So they might wear a scarf, or they go really with the shoulders inside, because either they don't have breast or they have lots of breast. Okay. So, but most of the time, this is my experience, and I have 15 years of experience as a plastic surgeon. So most of the times, even though they come like this and they get the breast augmentation, I can tell you in 100% of the cases, they have not changed their posture if they came in like that. Why? Because the picture, the image that they have from themselves, even after the operation, is connected with somehow insecurity. Sometimes it's shame, depending on if the girl or the lady is shy or not shy. And so they're not going to change it. They're still wearing, even though they responded at the beginning, I want to wear a bikini and I want to wear tight t-shirts and whatever. Even though they responded it, after that, they still go like, they cannot open up. And this is where I connect the inner beauty with the outer beauty. This is where I say, so imagine you prepare. Perhaps you don't want an operation after that, because you've realized on that process that your definition of beauty is what you are already. Perhaps you still go for that operation, but you might change perhaps the size of the breasts, because you've realized, that it doesn't have to be big. You just want, because you're a sporty person, you just want a size a little bit smaller or whatever. Or perhaps you even take the size that you wanted, but you prepare yourself and change the way you think about your old image. I always say, like, the identity with, we are staying with the breasts, with the identity with small breasts or huge breasts, or, and after the operation, the identity that you take once your breasts got augmented or they got reduced. So this is something which is so important, that usually we in medicine, we don't learn that. So this is something I realized doing all these seminars and the coaching programs myself. And I go like, so this is so precious. This is something I believe every doctor should know and plastic surgeon should know. To have this awareness and to guide the patients by certain questions that you ask them, and also prepare them on that they're ready to let go the old identity, because sometimes we stick, there is some positive stuff about the old identity. And if you want to be more, if you want to have more self-esteem, or you want to be proud, it's the same thing. You want to be proud of and want to be with this open gesture and position and physiology. Sometimes you also need to be more bold in the way you speak. And then we come back to the inner beauty. So what do I think about myself? What do you think about my body? What do I think? Do I have self-esteem? Did I anchor a skinny person, or a young woman with more success? Or did I anchor a young woman, or these full lips, do I anchor them with more sensual women? But what is sensuality? So this is like how I connect, and how I want to show you that plastic surgery and inner beauty, they need to go together, and they're supposed to go together. Or you decide, I don't need plastic surgery, I just continue and go for the inner beauty path, which is also awesome and beautiful. But I would like to, because I was speaking and concentrated on what I was saying, I did not check if there are any questions. So if there's any question, any doubts, anything you want to ask, so Heidi Klum, yes, feel free to raise your hand, and let's just get into the communication. I think Linda, right?
Hello. Yes, I feel very, yeah, it's very right what you say. When I take photos of people, man or woman, usually they say I'm not a photogenetic, and I say I can decide as a photographer. And then the first thing is like the posture, like the shoulders do backwards, and then talk and be, yeah. Afterwards, there is a lot of self-confidence, you know. And once somebody said, you gave me self-confidence, and you know, I didn't have that because of what you said, you are photogenetic. I can take good photos of you. And you said, yeah, these photos, they give me self-confidence. So it's not even necessary to change your body. It's just like in the mind and the way you feel and your posture.
Yes, I totally agree with you. If you, I was telling to Gunja before, I usually am someone who speaks freely. When I bring in PowerPoint slides, I'll get a little bit lost because I'm out of my flow. But I would like to, Gunja, I will try to share one slide if it's possible.
You can, Deary. It's open.
Perfect. So can you see this slide?
Yes, we are seeing.
What's half German, half English? I see. I forgot to. So what I like to compare beauty with this triangle. So we have our beauty. That's us, all us. It's the way we look, the physiology and the way we look. It is the focus that we have, and of course the words of expression and the value that we give the words. So what do I mean by that? You were speaking as a photographer. I love that, Linda. Thank you for sharing your experience, and I totally agree with you. So this is one picture of me. I'm sorry. So as you can see, even the posture, you can see me here. This is me, by the way. And you can see me here where I'm not sitting straight. And I have a totally, and you don't even see the face. So you don't see if I'm smiling, if I'm happy or whatever, but only by the posture, you see that it's a totally different expression that I give to the people once I'm up, sitting up, or once I'm sitting the way I sit there. And why I love this picture and I love to share that is because this is like one of the basic things that everyone can change. The only thing that you change in this picture is you don't change most of the people think, and I used to think that way too, that I have to bring my shoulders back, and this was so much work for me, and I thought I can't do that. But the only thing that you have to do if you want to sit straight is you just have to change the position of your hips. You can, wherever you're sitting right now, if you're sitting with the feet on the floor like this, or like me, I'm sitting like that right now. So you can try it right away, and sitting like that, or just moving the hip towards to the front, and it's a totally different position. So this is something so small that we can change. But of course, when I was speaking about the girls with the little breast or with the two big breasts who are trying to hide themselves, it is something where they practically and actively are moving the shoulders and hide themselves. So that's another thing where I believe it really has to make a change in the way they think. And then we go to the triangle back again, because we have our words of expression, or the value that we give the words, and thinking is speaking inside our head. Let's say it this way. So it's words that we're using. And I mean, I believe every one of you know the inner critic and the outer critic, and the fan club. When I started on my journey, I have to be honest, I did not have a fan club. I only had this huge inner critica. We had this, how do you say, baseball stick, and who was only going this way with me. Okay, you're stupid, you can't do it, whatever. And this is also, it was for sure one of the parts why I am so passionate about combining inner and outer beauty, because I think it is so important. And I love to teach young teenager girls, when they start and the body changes, so they learn about it early enough. So what happens, the word of expression. So as I said, you can use the word beauty, and for some people, beauty has a negative impact. If you tell someone he or she is beautiful, it might be that that person does not feel comfortable with that. Perhaps you know people who are beautiful, and you want to do them something good, and you make them a compliment, and they go like, no, 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 I'm not beautiful. Look at me this, look at me that, look at me that, something's wrong. So it is not only the words, because the word beauty in general is something where we go like, it's positive, isn't it? But it is the value that each one of us, and that's very individual, is giving the word beauty, youth, age, a belly, being sensual, being voluptuous, being skinny, whatever. And this is so important to see what how much power the words of expression have. And I usually make, when I do my trainings, there's one exercise, perhaps you know this exercise. This is where I was not blonde. I'm changing. On that picture. So there's this exercise where you can just, as you see on that picture, where you just point with the index finger in front of you, and then you close your eyes, and then you think about something positive. I'm not going to do it with you, but you can do it. And you think about something, it's easy, it's easy, it's easy, you can move, and then you try to move as far as you come. And just by telling yourself that you are like gummy, that you're flexible, that you're that it's easy, 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 you move way further to the back and easier to the back than if you think that your arm is heavy and you can't move it and you're tired. You just by saying that, you see, like, I'm not acting. This is what happens with our brain, and how much power the words have, and how much effect the words have on what we think. So if you think that you are not beauty, you're not good enough, your nose is too big, or your lips are too small, or your breast is too that, this is having an effect, not because they're small, or or they're big, or whatever. It is because you value them, and you judge them, and you judge them in a negative way. Because you might have the perfect breast for your best friend, and she goes like, oh, I wish I would have that, but she doesn't like hers, so she's judging on hers. At the same time, she's judging yours in a positive way, but which is not helping herself. So what I want to say is, that it is the words, that the value that you give the words. And this is another picture where, I'm sorry, this is German. So where, a friend calls you and asks you if you want to go for a drink, or if you want to meet at home for a drink and a piece of cake. So the cake, not the coffee, but the cake, thinking about the cake. If you give the cake the value of, this is a calorie bomb, it has a totally different effect on you than if you give the cake the value of, yes, let's do something, let's eat something delicious and just have a beautiful, fun afternoon. So this is still the words of expression and the value that you give yourself. And this is really the inner part of the beauty, which has a huge effect on yourself. It doesn't matter even if you don't want to do any plastic surgery, and if you're fine with yourself, still what you think about yourself in context with your work, with your profession, with your relationship, with your health status, very important in these days. So it has an effect on how you live and what you live. And then the last thing on the triangle is the focus, which is as I already mentioned a little bit, is, you either see a piece of cake and you go like, oh, we're going to have fun, we're going to meet and have fun, or, you just imagine, oh, if I'm going to eat that piece of cake, I'll have 1 kilo more and I have to go jogging, or I have to do that, and it turns you totally off. So the focus is something which has an effect, the language, what you think, but the focus in your life, what you put your focus on, has an effect on. There are lots of women in here. I don't know how many wanted to be pregnant once in their life period, but there's this typical thing, if you want to, or you're looking for a dress or something, like the guys, they look for some electronic stuff in the shops, or you look for a dress, a typical color or a typical design. So once you have something in your mind, all you see or what you're looking for is what you have in your mind. So you put your focus on. And sometimes when we have trained ourselves, I would say we've trained the muscle, we've trained ourselves to only see the defects, what is missing or what is not good or what we would like to change on ourselves, either the character, so how we are, or how we look like. If we only train this muscle, sometimes we really, we get, I would say, obsessed. It's a little bit, it's a trigger word, but I think it's okay to use that. So we get obsessed and we go like, I have to lose weight. I have to I can't, I have to stop eating. I have to do that to lose weight. I have to. And being obsessed usually is counterproductive, because what happens is that you're so focused on what you don't want. Even if you say like, I'm going to start today, like, you decide today, it's like tomorrow you're not going to finish it. You're going to start again, because you go like, oh, I still haven't lost that kilo, I still haven't lost that pound. It's not fast enough, because your desire is so strong, so deep. But it comes out of an energy of, there's something missing in your life, and it's not coming out of the energy that you're good enough. And this is where I want to go back to the combination, not the combination, of the complementary part of inner beauty and, let's say, plastic surgery or outer beauty, because it's not only about plastic surgery, is that if you go, I mean, you know that everyone has been frustrated once in a while, and perhaps did some shopping out of that frustration and did not really enjoy the shopping, just bought the piece of a pair of shoes or the bag or whatever, just, try to fill themselves from inside, but it did not help you. And most of the times you even not wear that dress or that bag or that shoes, because it came out of an energy where you were not satisfied. And this is exactly where I support my patients, my clients, that I go like, fill yourself with beauty, that you really like yourself. And if you go, then these are the patients, I was not speaking in the beginning of. These are the patients who are happy with themselves, and they go like, so I'll do that, I had my breast cancer, I'll do that. I get a reconstruction, or even an aesthetic surgery. I'm happy with myself. I just need a little size bigger or smaller or whatever. So these are the patients who are really happy, because they like themselves and they are whole with themselves, and they just go and get something additional. But then if sometimes, and that's why I combine the inner beauty and the outer beauty, because sometimes people come out of other reasons and they're not happy with themselves, and with injections, or if using fillers or Botox, sometimes women come and they go like, I look so old, I don't feel fresh, etc. And you can do the Botox and the fillers, but the thing is that if you feel tired, if you feel unhappy, it's a feeling. And material stuff, either if it's silicone or if it's even, if you have your autolog fat, or if you have the hyaluronic acid filler or whatever, it is something which is from the outside. And feeling fresh is something, it's a feeling. So it is something which comes from the inside. And this is exactly the point where I go, this is the most beautiful profession that I have, where I can combine this and give more value to my patients. So this is all I wanted to say. Now let's go one step further to this slide. So what happens if you don't like yourself? It doesn't matter if it's the belly or something else. If there's something that is bothering you, if it really bothers you that it becomes a, let's say, a problem or a wish that you want to change about it, and there are different ways that you react on it. So for example, let's take the body, because the body is something, you don't shape it. If you work out and if you change your eating habits in a way that you will always keep them, you won't lose 5 kilos in 1 week in general. So it is something where you need to have some patience and some persistence, let's say it that way. And sometimes if we have this lack of persistence and patience, and if you want things to work fast, what happens is that we get frustrated. We get frustrated with ourselves. We go like, oh, it didn't work out. I have to work out more. My body, my how do you say Stoffwechsel in English? Well, the way your body is going to work on the food that you're eating. I'm sorry, I'm missing the words now. So it's like, you might get frustrated. You might get frustrated and go to the refrigerator and eat. You might get angry with yourself. You might get angry with yourself and you castigate yourself by not eating at all. That could be one possibility. These are different possibilities I'm saying. I'm not saying that's you or someone you know, but it's these different strategies that our mind uses. Or you might become obsessed by doing workout and work out and work out and work out. And so there are different kind of, or you even go like, it's impossible for me, I'm going to give up, and you resignate. So there are these different ways that we confront ourselves, or that we react on different situations.